This week, we reported 1,743 new cases over 7 days, which is an average of 249 cases per day. That's a slight decrease from last week when we saw about 265 cases per day. Considering, of course, that many people are using rapid tests now. And if those tests aren't reported to our department, we don't have a handle on the numbers in the community. So this is a low estimate of the number of cases that we saw in our community last week.
Epidemiologist Breanne Agate led the conversation about the underreporting of COVID-19 positives countywide, saying because of increased workloads, contact tracing is no longer taking place except for at-risk groups like those under 18 and over 70. That's why she says personal responsibility is key.
If you test positive, notify your close contacts and they should be quarantining. Anybody who does complete a home test or just needs documentation for work is welcome to go to our website, chqgov.com, and we have isolation and quarantine documents there where you can fill in the dates that you were either symptomatic or tested positive. And then you can calculate out the number of isolation days that are necessary.
The group of health officials are working on a new way to determine how prevalent COVID-19 is countywide, as Director of Environmental Health Bill Boria explains.
We are starting up a wastewater monitoring program that is going to give us a real good general indication of what COVID is doing in our communities. You know, is it increasing? Is it decreasing? Is it staying the same? So, you know, that's going to give us, I think, a good measure of what's happening, regardless of, you know, who's testing and who isn't testing. And
the program, officials say, simply requires residents to use the restroom. Data collected from wastewater will then show how prevalent COVID-19 is in the community. Julia Gress, WNY News Now.